So hi everyone, I'm Simon, and I'm going to be in conversation with our fantastic Director of Adult Social Services, Jo Williams. But before we go into conversation just about our journey over the last 12 months, I just want to share one slide with you just as a way of introducing what's been achieved in Torbay as a response to the pandemic, which built on the existing partnership working across a range of agencies across sectors in Torbay as part of Ageing Well. So bear with me while I just do the share screen. So hopefully everyone can see the schematic on the screen there. This is our community helpline on a page. The community helpline, and the first thing to say is a big thank you to the National Lottery Community Fund for giving us the flexibility to adapt our support to deal with the needs that presented themselves as a result of the COVID pandemic. We were already in touch with a lot of older people in Torbay, and we knew a lot of those people weren't digitally enabled, didn't have access to the internet, and we needed to have access to friendly people who could help them out through lockdown 1. We launched the community helpline on the 16th of March before lockdown 1. Initially it was 7 days a week, it's now 6 days a week. But as you can see, we've had a significant number of people calling the helpline, in fact from all ages, over 6,000. We've registered over 1,100 volunteers who we could never have done any of this without, so a huge thank you to all of them. We've taken over almost 21,000 calls in the last 12 months and helped over 4,000 people in a range of ways in Torbay. So just on the left-hand side, we have a number of boxes in red. And just to explain briefly, because this was about responding to a crisis, we have a range of volunteers from local church groups and others, citizens from Torbay, who are on a rota of rapid response. So when someone has an urgent need, for example, they need a food parcel delivered or some shopping done because they've run out, we can access a team of rapid responders out in the community to deal with those needs within a number of hours. Like lots of places around the country, we've seen a massive increase in the amount of food bank referrals. One of the things we may talk about a bit later is the coming together of 12 individual food banks across Torbay into a food bank alliance, supported by both us and teams under Jo's auspices, to ensure we've got a coherent system in place to support people with food poverty. And we have a number of people who actually make the referrals into the Food Bank Alliance through this system. And it's been the largest demand over the last 12 months. Second, after that is around mental health needs. We have a fantastic team of community builders who have been matching the volunteers who've registered to offer help to their fellow citizens with those closest to them geographically and with the best fit, in order for them to actually help people with prescriptions, shopping, dog walking, and so much more. We've also got a comprehensive telephone befriending system in place, because a lot of people haven't been able to get out and make contact. Just that friendly phone call, whether it's once a week or less frequent, has made a real difference to people's lives. We've also got a network of transport in place, partly provided through our own community transport scheme, but also through Caring, a local patient support group who provide transport to appointments. And that system has also helped with the transportation of food parcels and also helping people get to test stations and vaccinations and so on. This project's been so successful that our local health system saw the benefit of this community support system to help those needing to discharge from hospital who don't have care needs. And although it says under development, that scheme is now live, and we are now taking referrals of people to enable them to get home safely, securely, and to ensure there isn't delayed discharge from hospital. Over on the right-hand side, we have a wide range of what we call triage supports, provided by over 70 different voluntary sector organisations across Torbay and a range of volunteers and paid staff. All of this is coordinated through our CRM system, our customer relationship management system, which all the partners have access to ensure that we can effectively support people with our motto, which is one call, that's all. This is not about signposting, about passing people to other supports. You make one call and someone calls you back or delivers the necessary support to ensure that you can lead the best life you can. So we've got a whole range of supports here: access into health and care where appropriate, mental health support from a range of other voluntary providers, a newly formed advice partnership made up of, I think, 18 local voluntary sector advice agencies. That's triaged on a daily basis, and the need is passed to the organisation with the relevant skill and capacity to respond to that person as quickly as possible. And I could go on down the list, but you can see them there. So what we have in Torbay is one collaborative network of support that actually helps people in need, not just for COVID, but actually anyone in need in Torbay. And now I'd like to invite Joe just to kind of talk with me for the rest of the session and maybe answer a few questions about this journey. I think it's fair to say, Joe, isn't it, that the journey started before COVID?
Yeah.
So would you be able to tell me a little bit about your aspirations for the way that social care works in Torbay, and where we got to before COVID hit us?
Yeah, so we were thinking in Torbay anyway about our approach to adult social care and our theoretical approach to, and the way that we work as a statutory social care service. And I should explain that in Torbay, the council has a Section 75 agreement with Torbay and South Devon NHS Foundation Trust. So our health and social care services are fully integrated, and they have been for coming up for 15 years now. So we've got a very close relationship with our local NHS, obviously. So we began to think about how we might change our approach, looking at strengths and assets. And we joined a programme called the Community-Led Support Programme, which is run by an organisation called NDTI. And that led us to reflect on changing our practice, because we were trying to get frontline social care staff to find projects and things that they could signpost people to, picking up on your point on signposting. But it really wasn't working for us to expect our frontline staff to know all these services, keep, match people. And also it was only ever going to be signposting, because the idea of what we're doing now, where we offer people the support, just wasn't there really, and we weren't set up that way. And it's not realistic to expect all of those staff, social care staff, to be able to do that, and they never will. So when we started the conversation about CLS, we started to talk to the Community Development Trust, the other voluntary sector partners we had for adult social care. I'm just saying this is adults at the moment. And I really had a bit of a, I don't know, was thinking about this. It was a bit of a road to Damascus moment, really, about how internal social care services were and how much was out there in Torbay that we're missing out on. The community builders and the community assets are a perfect example of that, really, that we just weren't able to, we just weren't aware of them and working in partnership as best we could. So from then on, we started focusing on our relationships with the community and voluntary sector, regular meetings talking about what we can do, and we sort of tried to see ourselves as a guest invited to those conversations rather than the other way around. And there are some key frontline staff who started to work the CLS model to adapt our offer to be more an outreach model into the community. And the frontline staff from adult social care and the voluntary community sector have started to lead that change and lead that dialogue about where we should be and where social care should be. A good example is we had an outreach, a talking point we call them, where people come and try and talk to us and talk to the community and voluntary sector offer. We had one in the job centre, and that came from frontline staff, community and voluntary sector staff, and the job centre saying, we really need you to come here and help us with this. And statutory sector, I would have never thought of that in a million years. So that's where we were. We did have good relationships and a good understanding of where we wanted to go together before we came to COVID, I think.
Thanks, Jo. Just for the benefit of those listening, I'm aware that maybe it might be helpful just to explain what's different about CLS. I know we didn't rehearse that one, but if you wouldn't mind.
There's the community-led support is basically a very, I mean, the underpinning theory and ethos behind is co-production, engaging with communities, going for social care to change its approach, to go out into the community and be there for people really in community venues where it's a natural touch point for people and for anybody with any request to get that support from a range of people who are at the table. So that would be community builders, social care, it might be debt, it might be a statutory social care need, but a different conversation that's easier for people to get to. So we were starting those and we had quite a lot of that rolled out already before we got to COVID.
So it's fair to say, Jo, that the shift was, rather than focusing just entirely on the care needs of an individual, it was a strength-based conversation with people about the kind of life they wanted to lead.
Absolutely.
And how could we, engage and involve the wider community in voluntary activities in enabling that to happen?
And what role statutory social care might have in that, but not as the lead.
Great, thank you, Jo. So just to move on, so we'd started all of that fantastic collaboration partnership work, and then obviously a global pandemic hit. How did that amplify, what we were already discussing in Torbay, and how did it change your aspirations in terms of the transformation of social care in Torbay?
Well, like I say, we were fortunate we had that good relationship and we had a solid foundation. And suddenly we all had the same problem. So suddenly we were all focused on the same thing based on these good relationships. We started to have very, very frequent conversations with our community and voluntary sector partners. So every week we would meet, and that was the faith groups. Basically, anybody who wanted to come to the table, we sat down together and we talked about the problem. The helpline emerged from the community and voluntary sector, as the helpline we just referred to, and quickly statutory sector saw the benefit of that and saw that this would be something that we should be a part of. And we relied heavily on the community and voluntary sector and the helpline right from the start. So there was no, we didn't have the time to be cautious. And the other thing is, it really sort of moved our aspiration for partnership and co-design. So I think for a good portion of the work that we did and what we achieved, it was the community saying, this is what we're going to do. We're going to set out and do this. And where can social care, and where for the council actually, and health in its broader section, where do you want to fit into that? So it was a different dynamic in the conversation, really. And in terms of going out, helping people, helping vulnerable adults, the volunteers and the way that the community builders worked in that were absolutely essential, really. We couldn't have coped without them. So we shifted gears, really.
Yeah, thank you, Jo. So I mean, in Torbay, we're all talking about something called the front door, and I just want you to just talk a bit more about the front door, because that's
I've changed my mind about this as well, the front door. I think, I've been thinking about this, and social care thinks about the front door. They think about when people ring us, or the other way in is through the hospital. You find yourself in hospital and suddenly you come to our attention. And I think that what we're now talking about is an open door. And so there isn't, but the reality of life is there isn't one way in, there isn't another way in. So it's how we as a community, and how the community and as a good neighbours and neighbourhoods help each other. What do I need and what can I contribute is absolutely the ethos of this programme. And if we're all sitting around thinking about that in a person-centred way, talking about people's strengths, part of that might be services you're eligible under the Care Act. But it's not just about that funnel into those services. It's really important that's been the main shift that we've had, really, and that's been a big step for statutory adult social care. It's massive, because we always think about ourselves in statutory sector and what we should be doing.
It's probably worth mentioning, actually, for the benefit of those on the call. So one of the key principles of the Ageing Well Torbay approach is to see people as contributors, not just as receivers of support and services. And by taking that philosophy, what we've actually managed to do is stimulate lots of activities, many of which actually had to be stood down, obviously, because of COVID, where the citizens of Torbay were running activities with and for each other. And I think it's a really important principle around co-production, isn't it? That actually, you know, the people bring so much to this. It's not just about them needing services and supports. So in our organisation, for example, with our team of community builders, we see every individual as a potential contributor. And the kinds of conversations we have with people are about, what do you care about? What do you love? What do you miss? What would you like to get involved in?
And there's lots of examples of that, isn't there, Simon? There's like one article you did about one lady who called the helpline because she needed some help with getting something like a medication or something. And in the end, she ended up being a befriender and being a telephone befriender for about 5 different people, and offering her, you know, natural sort of upbeat, chatty personality and helping people cope. And that's like a really good example of how we just look at those things differently, I think.
Yeah, so we really do embody and see the people as the assets in our community. Although obviously people do need support. You started to touch, Jo, on this kind of required a bit of a mind shift for you, didn't it?
Yeah.
You know, and I just want to acknowledge, I think you've been really brave. You know, in a statutory organisation with its kind of appetite for risk. Maybe you want to tell us a little bit about that.
So we've had to certainly shift our attitude to risk. You know, life's a risky business, isn't it? And it always has been, even for those people that were getting statutory social care. And we've had to really shift that. Like I say, there is a tendency for the statutory sector to want to do everything itself, and we're going to assess and we're going to provide the services. But I think what this has enabled us to understand that that's fine, and we will still assess people under the Care Act. We will still provide services, but this is part of a bigger picture, and people are going out into the world. And the other thing is, we've had to think differently about things like DBS checks, volunteers. So certain activities do require people to have a DBS, and they always will. But other things like being a good neighbour, we've had to change the way, and this is what COVID did for us, really. We had to think about really what the risk is, and I would urge people who are trying to do this to think about that, because the world isn't DBS'd. And it doesn't work like that. And the main thing for me as a leader in social care is that it's us going to the community and voluntary sector, the community's party, rather than it being the statutory sector and the council's party. So it's like arriving at somebody else's party saying, I don't like the music and I want to change the venue. It's not going to work if you do that.
I think that's a really important point, and lots of the lovely feedback we've had from people and lots of the thank yous. The people who take the calls on the community helpline are residents of Torbay. You know, it's a friendly voice, on the other hand, that listens and cares and fills out information on a database to enable the right support to ensue. It's not like a call centre. It's got a much more human feel to it, hasn't it, Jo?
Yeah, absolutely.
And I want to acknowledge, really, because what Jo and colleagues have basically said is we really value the way this has been set up as a collaboration of over 70 voluntary sector organisations and lots of citizens in Torbay. We don't want to try and statutarise it, if that's even a word. What we want is to put resources in to enable it to continue and to be the front door, the one call, that's all, for anyone in need.
Yeah, and the other thing, Simon, I think was learning, and as a mind shift was learning for us and our sector, is that actually this system was a really good IT system and a really good data system, and that's the other mind shift I think we had to have, that it's only the statutory sector, it's only the NHS and the local authority have got good systems, because actually the system that you've got, the Apricot system, is brilliant.
Yeah, just as I think it might be Middlesbrough, one of the other Ageing Better partnerships, who showcased the Apricot system to us. And I mean, there are lots of CRM systems out there, but the value of this one is it's super flexible. you can design any form to meet the requirements of what you want, rather than being shoehorned by the IT system. So it did require a bit of a mind shift for yourself, Joe, but also, I guess, I know within the statutory system there are a lot of stakeholders, there's politicians, so in terms of that journey and obviously persuading others to buy into your vision, what did you do to sort of ensure you had the political and wider stakeholder support, given that we've got an integrated health and care system?
Our administration in the council has been so supportive, and community engagement and co-design is a really strong part of their ethos. So that's the context for the conversations I had with cabinet and members. But you have to take them with you. You have to make sure people are involved in the conversations, that they get to express concerns they might have. And also, due process in a council is due process. So I've been to cabinet with half a dozen papers. I've been to various engagement and various party groups, and you can't step away from that. You have to do it, and it's right. It's the right thing to do. So that's the first thing, is that they've been very supportive. All parties have been very supportive of it. They're we're very community focused council at the moment, but you have to take them with you. That's the main thing. And the NHS system are also very focused on the community and voluntary sector. It's a bit trickier because the system is so wide, and the Devon integrated care system is so big, and I think the local nimble conversations we've been able to have in Torbay at a neighbourhood level and with the council are yet to fully translate through to a wider Devon system. But Torbay is very busy trying to influence those discussions about things like about having an open mind. If you have a conversation with the community, has to be an open conversation. You can't come with, actually, this is what we want to get out of this conversation at the end of it, and we've got this secret plan in our head all along, because it's really important that you don't do that really in these developments.
Yeah, I think it's a really important principle that we're exploring together, isn't it, Joe? So, I mean, I've worked in both the statutory sector and, similar roles to Joe, as well as being in the community and voluntary side of things. And I think, I can safely say for the first time ever that we feel like equal partners in this.
Yeah.
It's not like the statutory sector telling the voluntary sector, we want you to do this and we might give you some money if you kind of do it well enough types of the conversation. It's a completely different conversation. I think it's probably worth acknowledging that in order to maintain this community helpline, which was initially kind of resourced through the Ageing Well initiative, Joe and colleagues have put resources in terms of funding to maintain it. Health colleagues, both the CCG and our Foundation Trust, have put resources in to enable it to continue. And now we're in this process of discussing this project that we're sort of broadly calling the front door. And although this wasn't one that was in our list, Joe, I'm aware that even just in the last week, there've been conversations with other parts of our local system about their appetite to join into this. So I don't know whether you want to say anything about, we've got children's services, Devon Partnership
so children's
Trust.
Services are very interested, and the early help model. It's sort of, of course, the world doesn't split itself up into adults and children, does it? If a family comes to talk to us, that's their family with their granny, them, they can't feed their kids and the kids have got this problem, or, so that's what the helpline and the community and voluntary sector our partners are saying to us, and I think that we have to respond. And the other thing that we've been speaking about, we are an integrated care system, and we've been having some really interesting conversations about if we change the way we look at who we talk to and about eligibility. So we don't worry about Statutory Sector Care Act eligibility, that comes as part of the process if necessary. Then who comes through that door becomes very different. So, for example, I've been talking to a consultant recently in the hospital, a diabetologist, who's talking about people living with diabetes in parts of Torbay. If you live to 65, that's a good lifespan. Now, and diabetes is a massive part of that. She was getting really excited about how can we refer people into this and have these conversations via the helpline offer, and get people the support to you know, expand their lifestyle, be more healthy, their mental well-being. And those people may never be eligible for adult social care, or it might be 5 years away from eligibility. But changing that dynamic is really, really powerful. So the integrated care system now is starting to get really interested in the model, which is very exciting.
So this all sounds absolutely wonderful, doesn't it? You know, if you're listening to this, but I guess that the key to all of this is how do we sustain it? So a lot of this has been sort of set up with, you know, voluntary sector funding, like the Lottery Ageing Well money. What are our plans, Joe, in terms of sustaining this and growing this work so that we can be, you know, one integrated system across sectors, supporting people in need without pushing them from pillar to post, which is often the way, isn't it?
So there's a few things in there. So we are funding this from the precept. So messages to councils is that, you know, it does need funding, and you can't step away from what those co-production and those co-design conversations bring forward, one of which is we're really keen on not having different organisations in Torbay compete against each other for the money that we have. So we're changing the way, so procurement is a biggie, right? So we're looking at using an innovation partnership, which is a different type of procurement, to get away from that, to procure this service going forward. But ultimately, you know, the organisations out there, those people have mortgages, they've got bills, they need to, you know, and they need reliable funding to fund staff. So ultimately what we're trying to do is the revenue savings we anticipate from the model, which we do think will be significant. It's not why we're doing it, but it will be a bonus, obviously. We want to reinvest those revenue savings into procuring the service going forward as a sustainable service. And there'll always be additional funding coming in from various community and voluntary sector funding streams. We wouldn't expect it just to be our service, but we will expect to make a core contribution going forward if we can pull it off.
Thanks, Joe. So I guess there's a few things in that, isn't there? So what I was sitting with in my mind was actually, and then partly this was the pandemic, so I'm just going back a bit actually before I go on to the final question. We were in relationship with each other as you said, around a shared purpose of how to support people through the COVID pandemic, and you know, weekly meetings. So I think one of the important principles of co-production is to be in relationship with each other and build a trusting relationship. And I guess we've got that now. We've got something really solid to build from. But I guess I wanted also to make a link back to some of the learning from Ageing Well. So, and Joe and I have had lots of conversations about this over the last 12 months. One of the challenges of partnership working in collaboration, particularly in the voluntary and community space, is we're all in competition with each other for limited resources. So we don't naturally share with each other because we're in competition. You know, so every grant fund is a competition, every commission or contract is a competition. What Joe's talking about here is, and this is something that is part of EU procurement regulations, that's built into the last set of regulations, the concept of an innovation partnership. So we are exploring that at the moment, and there are other models. So others have used things like framework agreements to have something that you can call from. But what I think is really important to us in our journey is what we've seen is by coming together and sharing and supporting each other to support the people, actually it's so much more powerful, it's so much more productive, and we've managed to help so many more people as a result. So what we want is to foster more of that collaboration where we play to our respective strengths and link up those strengths as a system. There is some interesting work by an outfit called Collaborate CIC, who was set up to try and actually assist public sector commissioning processes to sort of shift the dial a bit on that. And as an ex-commissioner of services, it was one of my frustrations being involved in that way of working. So that the concept of an innovation partnership is a bit like alliance commissioning, which was also mentioned in their last report. If you go to their website, there's an interesting example actually in Plymouth where they brought together an alliance. Now, the learning from that alliance around multiple complex needs is actually how much time and energy those partners have to put into building the relationships of trust across the partnership. Because the key difference between the standard commissioning approach and an alliance or innovation partnership type commissioning approach is everyone's in it together. The commissioner and the range of partnership delivery providers, and they're also jointly responsible for all the elements of the delivery partnership. So actually we're all invested in making sure that every bit of it works, rather than one bit of it being beaten up because it hasn't achieved a target this quarter or whatever. It's a shared responsibility. Sorry,
yeah, and in terms of in my role, it's really important to say that the procurement team and the council have been with us on this, and you have to follow procurement rules. We are the council, so it's about finding a way that we can make that work for all of us, really, which is it is a challenge for us. We're absolutely in there in this space, and we're using this mechanism, which I'm confident will work. But you can't step away from the fact that, you know, there are procurement regulations and the councils have to follow them. And if you don't do those things, you're setting yourself up to fail in a change programme. You know, you have to face what's there. If the community voluntary sector say we don't want to compete against each other, we have to think about sustainable funding. We also have to listen to our support services in the council saying, remember, you've got to follow procurement rules. Everybody's voice is equal, and that's everybody's voice.
Just picking up, Jo, on the sustainability bit. So taking aside the challenges of procurement rules and so on and so on, I mean, one of the other challenges, obviously, for the voluntary and community sector is around short-term funding. So people have done analysis, haven't they, around the proportion of voluntary sector paid time and voluntary time that is spent trying to secure short-term funding. So could you say, Jo, I mean, what is your aspiration in terms of that? So, you know, if we want this community helpline to become this front door for everyone in need as a partnership between sectors, what sort of funding arrangements would you envision? We might not have got there yet, I appreciate, but in terms of longevity.
So my view is that we need to think about statutory sector funding is there. I mean, goodness knows who's going to be paying for it and where we're going with the future if we ever see a white paper, but you know, it is there, and we have got core funding going forward. And so I've always thought that, you know, it's that sustainable funding we need to be using to fund these models through contracts, through different arrangements about workforce. So it's that really in a nutshell, to not use non-recurrent money to do this, to find a way to shift it into recurrent funds with contracts that are longer than a year. They're 3-year contracts with the sector and the community. Otherwise, you know, you can't keep staff, and people are thinking about, well, my contract runs out in March, and we just can't do that to people. We have to think about a way of, you know, giving them surety.
Yeah, and I guess the added benefit of that is that then, you know, lots of us don't have to spend our time chasing around trying to find short-term funding to shore up elements of the system. You know, we can actually, you know, secure other funds to sort of, you know, develop further services or additional supports. I think one of the important principles of the journey of the community helpline over the last 12 months, I mean, when we started back in March last year, predominantly all the calls were people quite anxious about, you know, well, how am I going to get my shopping? Because I'm not supposed to go out because I'm shielded or whatever. And there wasn't any food on the supermarket shelves at the beginning. I mean, you know, and how do I get my prescriptions to make sure that, you know, my health condition doesn't get exacerbated? But over time, the nature of the calls has shifted. And we could share with you statistics, but as I said earlier, the biggest demand has been around food parcels. And actually, Jo, I don't know whether you want to say anything, but that's led to us having conversations and you writing papers within the council and putting additional resources in around how we look at our food system, for example.
Yeah, so we started with different conversations, individual conversations with various food banks, and quickly we supported through statutory sector staff and the NHS staff this in very much a servant role, helping the food projects to work together, and they formed the Torbay Food Alliance. And being an alliance and being an organisation like that, it's not an organisation, it's a partnership, an alliance. You attract people like FareShare and big companies giving you money because they, you know, you form yourself in their image and they're comfortable with it. So that was really successful. It wasn't just statutory sector funding. There's a big amount of crowdfunding went in. We had big contributions, and that was worked really, really well. And they've given out like 500,000 meals now or something. It's an amazing achievement. From that, again, not stepping away from the messages, even though sometimes you don't really want to hear them. We've realised that this is about poverty, it's about food poverty, it's about access to cheap, healthy food for everyone in Torbay. So we've evolved it now into an emerging food partnership, a cross-sector partnership that we're looking at with the food banks, but also, you know, community garden projects. Local businesses have been very interested in getting involved. So we're going to look at now a sustainable food partnership for the Bay that thinks about the supply of food and healthy food for people, not just reactive food parcels for people who can't get food. Although giving people food parcels if they're in food poverty will always be a part of the offer.
Yeah. So as we sort of bring our discussion to a close, and I'm sorry that we haven't got space for questions in this session, but I'm sure if people post any queries, we'll try and respond. You can use the chat space, but probably need to put your email address or something in there. Didn't rehearse that bit, sorry. So what we've seen is the coming together of a community helpline partnership, which now sits under the auspices of a wider voluntary sector wellbeing network, which was launched in the middle of the pandemic. We've seen the coming together of a newly formed advice partnership, partly built on the work of the FAIR collaborative commissioning project that was part of Ageing Well, that we'll be writing up and showcasing soon. We've seen the Food Bank Alliance coming together of, I think it was 12 individual food banks.
We've also incorporated the breathing space work as well, Simon, now. So that was amazingly straightforward. Yeah,
and we've seen the emergence of a standing tool partnership, which is led by the voluntary sector to actually sort of provide additional supports for people struggling with domestic abuse. So what we've seen in Torbay, I guess, is a coming together on a level we could only have dreamed of, really. And I think we'd really like to advocate this type of approach to any place, because the ultimate benefit of all of this is the people actually in Torbay get access to the right support as quickly as possible from the right organisation or the right individual to support it. So actually the outcomes for individuals, hopefully, all said and done, this will make it a better place for people living in Torbay and enable them to live a better life. And I guess I commend the coming out of COVID and the ability for us all to reconnect, because one of the things that we're just starting now to sort of get into is how do we encourage people to come back out again and to re-engage in the wider community after a year of being locked in. So a lot of our workers, both community builders, wellbeing coordinators and others, are really kind of focused now on how do we reintroduce all the fantastic community supports that all of this relies on moving forward. So just want to say a huge thank you to Joe for agreeing to come and have a chat with us today. And just ask Vicky just to do a quick wrap up if you're there, Vicky, and just tell you about some of the other events in the festival.
I am here. Thank you. Thank you very much. And thank you very much for taking us through your journey and sharing your journey with us, and for that very open, honest and thought-provoking conversation. I really appreciate you taking part in the festival. And this is actually just one of several sessions that Ageing Well Torbay are contributing to the festival. We've actually got another one in just 15 minutes time, also around the theme of co-production in a crisis. I know that the links for all the sessions have been shared with everybody today, so even if you haven't booked up and you want to jump onto that session at 1:45, it's a much more sort of practical, interactive session where you can really get to grips with how the area have worked with community partners, citizens and volunteers during the COVID-19 pandemic in a unique and inspiring way. So that should be a really fun session. And then tomorrow is all about asset-based community development, but a range of different sessions all around ABCD that you can also jump onto if you're not already signed up. And again, there's some sort of introductions, presentations, but also very interactive workshops coming from the team over in Torbay tomorrow. So thank you once again, everyone, for taking part. Thank you to all of you for attending, and we hope to see you across some of the other sessions across the week. Thank you.